Hi everyone, this is Shalu Kumar again from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. I'm back with another video for you about your adult NMC OSCE exam. So if you like my videos, please press the like button now and subscribe to my channel. It just gives me a lot of motivation to keep making videos for you, and hopefully looking at your comments, it looks like these videos are helping you in preparation of your exam. Okay, so in today's video I'm going to be talking about another care planning station. Okay, so we're going to write another care plan today. Now this one is quite popular one in your exam. It's about the risk of malnutrition. Okay, so I'm going to be, lots of you have been asking me to do this one, so I am going to be talking about risk of malnutrition care plan in hospital scenario, because in exam it can apply to your lots of different hospital scenarios, okay, where your patient may have reduced oral intake and your patient may be at risk of developing malnutrition. So we're going to look at that today, how to write it for an in-hospital patient. So I'm going to talk you through the template, then I'm going to tell you what to do, and then we're going to write a care plan at the end with the whole complete template. Okay, and we're gonna make a scenario to do that. So that's what's going to be today's video about. So let's get started. Okay, so just as a refresher, if you haven't watched my other care plan videos, please go ahead and watch those first, because then this one may make more sense to you. There are already videos on the general care planning, and then also there are other videos on some nursing needs which I have already done care plans for. Okay, and the description of those videos, the information about those videos, the link is added to the description of this video. Okay. Just as a refresher, care planning is your 14-minute station. It's a written station. You need to write two very clear care plans based on two nursing needs of your patient which you have identified in assessment station. Okay, and then you will already have completed the assessment station and implementation station by this stage. Okay, so they are now going to ask you to do your planning station before assessment and implementation, and then you will be given assessment and implementation paperwork back to write your care plans. Okay, so you will have the paperwork back from your assessment station and your implementation station. Okay, so next we're going to look at a scenario and we're going to look at the template. So if you look at this template here, now as a disclaimer, this does not belong to a real patient. I've just made this scenario completely just for the purpose of teaching. Okay, so as you see, you're quite familiar with this template because we have used it in other videos. As you can see, this is a planning station, planning medical care plan here for a medical admission. You will write your candidate name, and then there is a scenario. Your scenario, the patient you met in assessment and implementation, it would be the same scenario, will be written in the box here. So in this case, Matthew Smith was admitted earlier today with the shortness of breath due to pneumonia. Okay, so a community acquired pneumonia. So they are now asking you, on the basis of your assessment which you have already done, please produce two nursing care plans for the two relevant nursing care needs. Okay, and the nursing plan should be valid for next 24 hours. So that's the time period you're thinking when you're doing the care planning. For this patient, it's a written station. You need to write clearly and legibly. You have 14 minutes to complete it, and they tell you the time is today, date is today, the time is this when you're doing your care planning. So you can use that within your care plans. Okay, so if we look now, inside is your blank page. You're going to have 3 of these blank pages to write your care plan. So we're going to fill one of them today with this malnutrition care plan. Okay, so how do we write malnutrition care plan for a hospital patient? So principles are the same. So we're going to look at the template and complete it now. So I've already shown you the blank one, but now we're going to complete a template for the care planning. So if you look at the first box, which is your patient details, they're already completed for you, so you don't need to worry about those. So they will already be completed for you, so you don't need to spend any time on that. Okay, next we work on the nursing problem or need. So that's what we need, when we need to add our risk of malnutrition for this patient, because you would have already identified that Matthew hasn't been eating that well for last few days. He has reduced appetite due to shortness of breath related to pneumonia. So you have already done that assessment, you have already worked out the nursing need in assessment station. Now how do you word and write a risk of malnutrition care plan? So if somebody's oral intake is reduced, of course there is a risk for malnutrition. That's why we're writing this, that's why this is our nursing need, and that's why we need to obviously write a care plan on that, because this is an important need for our patient. So the first thing is, so we're going to, how we're going to word it, we'll say Matthew is at risk of developing malnutrition, okay, due to reduced oral intake related to pneumonia or related to shortness of breath. Both will be correct, okay, because it's his shortness of breath and his pneumonia which is giving him reduced appetite, okay. So that's how we would write it. We will keep it simple, so we'll say Matthew is at risk of developing malnutrition due to reduced oral intake related to pneumonia. Okay, so what is our aim of care now? So aim of care is, remember, is always what you're trying to achieve regarding malnutrition. So if Matthew is at risk of malnutrition, of course our aim should be to prevent malnutrition. So we're going to say to prevent malnutrition for Matthew by increasing his oral intake, okay. So going forward, so that's how we will write it. So we will say, okay, to prevent malnutrition for Matthew and to increase oral intake. You can write it for next 24 hours because we're making the care plan for next 24 hours. But even if you write for hospital stay, that should still be okay, right? So that's your aim of care. Keep it simple, keep it straightforward. Okay, so now re-evaluation date, because he is in hospital and we know in hospital there is a certain standard for nursing round, so we'll talk about that. But anyway, I need to go and so aim of so re-evaluation date will be, you will write first today, which is your exam date, write that, and then you will say at every meal time. Why? Because we need to go and check how much of the meal he's eaten, okay. So because we will be recording that, so re-evaluation should be that every meal time, okay, at each meal time, comma 2 hourly as per 2 hours as per nurse round, every 2 hours as per nurse rounds, because that's just kind of standard in NHS hospital, or sooner if his clinical condition changes. So that's what we're going to write in our re-evaluation box, okay. So write the date today, which is your exam date, and then we will say, okay, at every meal time, because I do need to go and check how much he's eaten, comma every 2 hours as per nurse rounds, or sooner if his clinical condition changes. Now we're going to go to the main part of the care plan, where we're going to write nursing interventions about how we're going to increase his oral intake, because we said our aim is to increase oral intake. So what kind of things can we do, to prevent malnutrition and increase somebody's oral intake? Okay, so the first points are generic points which go into most care plans. The first one is explain care plan to Matthew and gain consent, simple one. Second one is monitor and record Matthew's vital signs, and you need to add the frequency of monitoring as per your new score on that day when you do the assessment station, and escalate as per news to policy. So monitor and record Matthew's vital signs and add the frequency according to your news score on that day, and and then escalate as per news to policy. Third thing is we're going to document all care given to Matthew. Number 4 is administer all medications as prescribed and check for effectiveness. Number 5 is show Matthew how to use the coal bell, okay, and make sure it's within his reach. Number 6 will be, we're going to, because we're talking about risk of malnutrition, so we need to actually be objective and use a tool to see if he's at risk of malnutrition. So our plan will be to complete malnutrition universal screening tool to assess for malnutrition, okay, and then once we completed it, we will complete that on admission and then review it weekly. And we are going to then, if we need to, we will refer Matthew to dietitian. So the point is, a complete malnutrition universal screening tool to assess for malnutrition, review it weekly and refer him to a dietitian if needed. Okay, so if our malnutrition universal screening tool shows us that he's at increased risk, then we can refer him to a dietitian. So next is, encourage Matthew to eat small but frequent meals or snacks throughout the day, because when somebody loses their appetite, they are not going to be able to complete full meals. If you put a full meal in front of a patient who's got loss of appetite, they're not going to eat any of it, because that will put them off straight away. So we're going to provide him with simple snacks, small frequent snacks or meals, small meals, but more frequently throughout the day, and that way hopefully we can increase his oral intake. So we will say, encourage Matthew to eat small but frequent meals to increase oral intake. Document Matthew's, next one is, we need to document everything he's eating, because we need to monitor it. Document Matthew's oral intake on a chart. And then next one will be, encourage Matthew to drink 2 to 5 liters of fluids a day, because that's really important to keep him hydrated. And then our health education can be, advise Matthew to eat well-balanced diet. Okay, so we are aiming for still well-balanced diet. We're aiming to give him small frequent meals and plenty of hydration. That's how we're trying to prevent the malnutrition. So very simple points. We do it all the time for our hospital patients in hospitals or community, or even if you are not well, those are the things you will be doing to make sure you're still getting enough energy, enough nutrition to get better from whatever little illness you have at that time, which is causing you loss of appetite. Okay, so that happens so often, and that's how we address it. So that's how we will go ahead and apply those principles to this scenario and to this risk of malnutrition care plan. So very simple, but need to be written clearly. So name, then you need to print your name, make sure you don't forget that, and put your signature and add your date, which is the date of your exam. Okay, because which says on the, if on the front of the template, if it says today, then you can add date as your exam date. Okay, so that is what a risk of malnutrition care plan should look like. You can adapt it to your different scenarios if according to your patient condition. So that's what you should aim for. So obviously, if your patient is somebody with chronic heart failure and they have shortness of breath and loss of appetite, obviously in that case you would not advise patient to have free fluid, because patient will be on restricted fluid. So use this care plan as a base for your malnutrition care planning, but make sure you keep into mind your patient diagnosis on the day, because for chronic heart failure we are not going to put them on free fluid of 2 to 5 liters. We obviously, the patient will be on restricted fluid. So keep that in mind and change that point, that give fluid as prescribed by the medical team. Okay, so that's the little change just to point out to you. Okay, so top tips. It's a written station, so make sure it's clearly written and legible. Second thing is, make sure that risk of malnutrition is an important nursing need for your patient. So if you're choosing a risk of malnutrition care plan, make sure that the patient you assessed in assessment station does have that risk of developing malnutrition. Okay, they have a history of reduced appetite or reduced oral intake. Yeah. Number 3 is again, I would say make sure you are writing the name of your risk assessment and the referral. That's really, really important. Number 4 is adapt it to your scenario. Like already given you example of chronic heart failure where we would not advise free fluids. So make sure you adapt it to your scenario. Number 5 is, don't forget to sign and date it. Okay, add your name, sign and date it. And how many times people just fail because they run out of time and they haven't done that. So those are my 5 top tips for this risk of malnutrition care plan. So I hope you like these videos. If you do, please press the like button now and subscribe to my channel. You can also visit us on OSCEnurstraining.com or can email us for more information on our OSCE training, which is delivered face-to-face and online as well. You can email us on OSCEnurstraining@outlook.com. I will soon be back with another video for you. Bye for now.